Neck CARs, you're going to bring your chin down to your chest, to your collarbone, dip it over behind you, find your other collarbone, and then reverse it. And this is a sped up version. From this angle, you can see that I'm dipping my ear over my shoulder and then I'm reversing it on the opposite side and then I'm sweeping to get that collarbone, and this is sped up. T-spine CARs, you're going to fold forwards, find your right pocket, dip your shoulder blade behind you, T-spine extension to the ceiling, and then opposite, back pocket, front pocket. Now from a side angle, you're rolling or flexing your T-spine forward, dropping to your front pocket, trying to dip your shoulder blade to your back pocket, getting a little bit of T-spine extension to the ceiling, and then repeating the opposite side. One thing to note here is I'm trying to get more T-spine extension for myself, and I am lacking it. Total spine segmentation. So I'm starting an extension, and then I'm going to round my pelvis, round my lower back, round my T-spine, and then bring my head forward. And then I'm going to repeat it, but opposite. So pelvis is going back, lumbar extension, T-spine extension, and then repeating. Sidelying hip CARs, I am starting a hip flexion, coming up to abduction, externally rotating, extension and adduction. Then I'm reversing it. So I'm coming up and around, and I'm making sure that I try to think of moving my hip joint when I reach an end position, and I'm trying to rotate as well. You might notice that I'm trying to keep my whole torso, prevent it from rotating while I rotate my leg around my body. So from this angle, we can see that I'm trying to get hip extension and maintain hip extension, up and around, and I'm bringing it into adduction as well. And here's one more angle from the back view, trying to get abduction, externally rotate, come down, and adduct. Here I'm trying to get tibial CARs, and I'm trying to lock my leg in place, rotating as I come up, rotating as I come down. One thing to note is I'm trying to straighten my leg as best I can. It's also not just a foot movement, it is a tibia or shin bone rotation. One thing that you can also do is palpate the lateral and medial parts of your leg and feel the hamstrings working individually. So for ankle CARs, we're also locking the leg in place. You're going to get the top hand to be on top of the tibia to make sure you don't rotate the tibia while you rotate your foot.